which is not just shameful, I think it's embarrassing. And vaccines are one of our best tools to slow the spread and keep people out of already full hospitals. Anyway, I wanted just to quickly touch on those and now get to the important business at hand. And I want to thank everyone for joining this important discussion about Medicaid expansion. The Affordable Care Act was passed in 2010. It included a historic expansion of Medicaid eligibility to everyone with incomes up to 138% of the federal poverty level. Unfortunately, in 2012, the Supreme Court changed the mandate in the law and made expansion optional, leaving the decision to each state's legislature and governor. In Florida, we have fought hard to push 2 Republican governors and multiple legislative leaders to accept tens of billions of dollars in federal funding to get comprehensive health benefits to all Floridians. And it's not just Democrats in the legislature and around the state. This is a bipartisan issue. The business community, medical community all understands the importance of expanding Medicare. Currently, Florida's Medicaid income limit for parents is 31% of the poverty level, $6,936 per year for a 3-person family. Subsidies to help pay for coverage on healthcare.gov aren't available unless you earn over 100% of the poverty level. So without expansion, nearly 1 million Floridians fall into the gap in coverage. Healthcare should be a right to everyone in America. Medicaid expansion is one of the best tools that we have right now to slash the uninsured rate and get people access to quality care. I supported additional funding in the American Rescue Plan to again push Florida to accept expansion. The governor has refused to act. State legislative leaders have refused to act. That's why I'm supporting several ways forward at the federal level. One is the Medicaid Saves Lives Act that would create a federally operated program to provide coverage for those who fall into the gap. Another is the Cover Now Act to allow cities and counties to work with the federal government to set up their own expansion programs. Cities and counties could also work together to create regional expansions. And finally, we're working to include Medicaid expansion through the budget reconciliation process. Earlier this month, Senate Majority Leader Schumer included Medicaid expansion as one of the priorities as the committees begin crafting budget legislation. And that we need to look at all of these approaches as we go forward. Today, I'm grateful to be joined by an excellent group of guests for the discussion so that we can turn it over to them and I can stop talking. We've got Florida Senator Tina Polsky, Emergency Room Doctor William Jacobs, the past president of the American College of Emergency Physicians, Allison Yeager from Florida Health Justice Project, and Scott Darius from Florida Voices for Health. First, I'd like to turn it over, jump right in. I'd like to turn it over to Senator Polsky to hear about the fight that she's been so instrumental in leading for Medicaid expansion in Tallahassee. Senator Polsky, I'll turn it over to you.
Thank you, Congressman. Proud to be your state senator. And I want to thank you for your comments, of course, on Medicaid, but also on the international crises that we're all seeing, and of course, COVID, which I'd like to talk about a little bit. It's really simple. I don't understand why healthcare coverage is a partisan issue. We all go to the doctor. We all need health insurance. Why Florida has chosen the path of partisanship simply because President Obama is the one who had put forth ACA. It just doesn't make any sense. You know, a lot of Republican governors just drew a line in the sand to not help their constituents in favor of a political statement. And this was before my time, but I understand Governor Scott at first was in favor of Medicaid expansion. It passed the Senate, the Florida Senate, and then he changed his mind and it died in the Florida House. And that's kind of the way things go. So each year since then, Medicaid expansion has been proposed by Democratic legislators in both the House and the Senate, and it never gets a hearing. And it's really unfortunate. I've had conversations with individuals and asked them why, Republican legislators, and they say, well, it may seem like it doesn't cost us anything in the beginning, but it's just too big a price tag in the end. Now with what the federal government is offering to pay for multiple years and then 90% thereafter, it just doesn't make any sense to turn down this fantastic gift that we'd be given. The state spends billions of dollars on healthcare for everyone, and whatever we pay in all of our agencies that take care of people, what we pay to help hospitals, community health centers, billions and billions of dollars. And that increased when so many people had to be put back on the Medicaid rolls during the recent pandemic. So we spend billions of dollars, we're just not spending it necessarily in the right way. And we have billions of dollars in reserves. And we do very well in our budget. We just created a budget of $100 billion. It's a question of priorities. What is more important to the state? Is it more important to provide healthcare for all of our citizens? And there are obviously many citizens who fall into this gap. So to not care about them is just beyond my comprehension. It's really a question of where we want to put our dollars and who we want to help. And in the end, from the experts who will speak, will tell us that getting preventative care will save the state money in the end. It will save hospitals. Instead of people going to the ER for a cold, a flu, they can go to their doctor. They can get preventative mammograms. They can prevent cancer. And we know how much that would cost the state for indigent care. And so it's very important that we provide this insurance upfront to those who need it. And it's just an astounding number of people who really do require it. COVID has shown us the gaps that we have in medical coverage. And one of the reasons we're having so much trouble in the hospitals right now is because people are going to the ER. And I'm sure our doctor can speak to that. And we are very full. And in fact, I represent the area of the Glades, and we are having to find hospital beds for people that no one else in Palm Beach County can take them. And it's a devastating situation. But if people have preventative care, if they have the opportunity to go to the doctor, they could potentially get treatment there and not go to the hospitals, and free that up for desperate people who need to get there. So, I will continue to co-sponsor the bills for Medicaid expansion. I am not optimistic that it would happen in this coming election year in the Florida legislature, which starts in January, but we will continue to fight for it. And I'm so glad we have forums like this that we can express the importance of it and hear from the experts to see if we can help convince and help public opinion get there and encourage our Republican leadership to finally do the right thing and fill this Medicaid gap that we so desperately need. So thank you for having me, and I look forward to hearing from the rest of the folks. You're muted, Congressman.
That's just the way most people like it, Senator Polsky. Next, let's go to Dr. Jaquist, who can share his insight about the importance of comprehensive coverage and preventive care and the challenges for hospital emergency departments caused by this Medicaid gap. Dr. Jaquist, let me turn it over to you.
Well, thank you, Congressman. And I can't remember how many times this year I've heard you're muted. So we've all done that during all the Zoom years that we've gone through now. As Congressman said, I am Bill Jaquist. I am the immediate past president of the American College of Emergency Physicians. Just briefly, it's a 40,000 member organization, 51 chapters, and obviously has impact in our membership through all of the country and beyond in terms of the pandemic and a lot of issues like this that are related to coverage. As the two prior speakers have said, coverage is incredibly important when we look at emergency care, but also preventative care. In our world, in emergency care, what we see is all of the acute unscheduled care that needs to be seen in our hospitals for people who believe they have a life or limb threatening place where they need to be seen as quickly as they can. Having the ability, and the American College of Emergency Physicians believes that everybody, as the other speakers have said as well, should have some form of coverage for care. That form of coverage for care is really about access for any of them, according to the amount of care and that they need and the protections that they have in there. And not having that ability to seek care harms them in many ways. Many people delay care. Many people then can't access that preventative care that might help them later on. So we truly believe that there should be an insurance or a form of coverage for all Americans because they need that access to care, not only on the acute side where I see them, but on the unscheduled side, on the preventative side as well. The effect on care we've seen, unfortunately, not having that access for many years. I've been an emergency physician for at least 2 decades plus. And when you have areas where they don't have access to that level of care, a lot of things can happen. The first is that they don't seek care. And so they build up that healthcare need until it's at a point where it's really an emergency and they come to see us in the emergency department. I think also when we talk about these things, we can't talk about them without talking about social disparities and disparity in care and health equity, because without that, we see what we see now. You know, some people in our profession talk about this as sort of death by zip code. If you don't have care and you don't have coverage, which is our underserved communities, there's a massive disparity in terms of healthcare outcomes. And in a short time, I can't go through all of those, but it might be infant mortality for those mothers. It may be people who need care for their stroke or their diabetes or their hypertension or all those issues that can't get that care or that preventative care and then end up in the emergency departments, or even worse, their mortality comes much, much sooner for all of us. For all of them versus me, frankly, hopefully. But as we look at that, so we need, and as we've seen in this last year, during the COVID years, all of that has become more pronounced. And what we found is with fewer areas to access care and with less coverage, obviously people who access their insurance through jobs may have lost their jobs, may not have the same access in the last year. And that has led to pretty bad outcomes in many ways, with the disparities in many of our underserved communities, which are the populations who are served at times by Medicaid. The congressman mentioned the Medicaid gap, but I'll just reemphasize that part of the issue is, of course, a lot of these communities can't purchase care on their own. They don't have the means to do so. And they fit into that gap, and especially if they may have lost employment, where they are not able to access insurance. They can't get through other forms of insurance, and therefore not eligible for Medicaid, given the way certain states have approached that. They fit into that gap. All of those things we've just talked about can happen, where they don't have access to preventative care. They don't have access for their social determinants of the care issues they already have. They wait longer, and then they come to our departments really sick, frankly, in many ways, but also sick as a result of those particular lacks in coverage. So just from wearing my emergency care hat, which is what I do all the time, but also that understanding of the healthcare communities that I've gained over the years by working in a lot of underserved communities, and by the role I play in the American College of Emergency Physicians, that cradle to grave coverage has to include something for this population so that they can begin to get healthcare early. They can prevent some of those things that become more of an issue later on, and frankly are more expensive to take care of later on in life. None of us really want to have that happen. And I will add just one more thing at the end, because I have an audience. Get your vaccinations. It's incredibly important. What we're seeing now in a lot of our hospitals is the number of people who are coming into the hospital, staying in the hospital, and going to the intensive care units are the ones who are not vaccinated. And so go get your vaccines. And that's my public service announcement for the morning, I guess. Thank you.
Thank you, Dr. Jaquist. Thanks for sharing your expertise and insight, and for that very important public service announcement. Next, we'll hear from Allison Yeager. Allison is Executive Director of the Florida Health Justice Project, and she will speak about the economic impact of Medicaid expansion in Florida. Allison.
Good morning, and sincere
Hi.
thank you to Representative Deutch for including us in this critical conversation, and to both you, Representative Deutch, and Senator Polsky for your leadership and your support on the issue of Medicaid expansion, which is so essential for Floridians. Florida Health Justice Project, briefly, we engage in comprehensive advocacy to expand healthcare access and to promote health equity for vulnerable and marginalized Floridians. And Medicaid expansion is absolutely critical to expanding both access to healthcare and to promoting health equity in Florida. So really, as a healthcare advocacy organization, there is no goal more essential than Medicaid expansion in Florida right now. So we know, as we've heard, Medicaid expansion is good for health and it's good for public health, but we also know that it's good for both the economic health of Florida's residents and for the state coffers. As the senator said, we hear over and over again that there are economic reasons to refrain from taking on Medicaid expansion. In fact, just the opposite is true. So to start, Medicaid expansion is associated with improved financial outcomes for Medicaid beneficiaries. We know that medical costs are a source of tremendous financial strain. In fact, a study that was reported just last month in JAMA, the Journal of the American Medical Association, found that in the pre-COVID times, an estimated 17.8% of individuals in the US had medical debt that was already in collections. So nearly 18% of US residents had medical debt in collections, and that the medical debt, folks experiencing medical debt, it was highest among residents in the southern states and in lower income communities in states that had not expanded Medicaid. So Floridians are experiencing disparate economic strain as a direct result of our state's failure to expand Medicaid. At the same time, research has also highlighted the economic advantages for residents in expansion states. In particular, we know that expansion has allowed newly covered individuals to spend less money on medical care and costs. That's intuitive. To experience less difficulty paying for care, to worry less about paying future medical bills, which means, of course, they're less likely to refrain from going to the doctor. In other words, they're more likely to seek care when they have insurance. And again, the Medicaid expansion has significantly reduced the percentage of individuals with medical debt and reduced as well the average amount of that medical debt. So in this moment where we're trying to claw our way out of the economic recession associated with the COVID pandemic, and as Floridians are trying to get back on their feet during this catastrophic recession, really the ongoing burden of medical debt is both cruel and unnecessary. Medicaid expansion has also been shown to facilitate individuals' participation in the labor market, which again makes perfect intuitive sense. And it's so critical now as employers everywhere are reporting staffing shortages. So data from Ohio, for instance, which is an expansion state, found that more than 4/5 of Medicaid beneficiaries there who were working reported that health coverage had made it easier to work. And nearly 2/3 of the unemployed beneficiaries in Ohio reported that coverage had made their job search easier. So if we want to facilitate people getting back to work, getting back into the labor market, we know that providing health coverage is a critical tool to making that happen. Medicaid expansion is not only good for individuals' finances, it's also good for the state's finances. As I said, we often hear claims that Medicaid expansion will be a drain on the state's resources, but the fact is research from states that have expanded Medicaid debunk these claims, and just the opposite is true. Expansion has been shown to save taxpayers money. States that have expanded Medicaid have used new federal dollars to offset state spending on other priorities like mental health and substance use services that are currently paid for entirely with state dollars. And this offset allows for state savings. The Florida Policy Institute, who we all work closely with, we at Florida Health Justice Project and Scott at Florida Voices for Health, Florida Policy Institute has estimated that expanding Medicaid would save Florida nearly $200 million just in fiscal year 22-23. So an infusion of federal funds will ultimately generate billions in economic activity annually, because we know that as we bring more money into the economy, not only is it saving the state money on current state expenditures, but it's also generating wealth. It's money that's being fed into the economy and has a ripple effect throughout the economy. And South Florida would benefit disproportionately from that infusion of federal cash. So in sum, an expansion of Medicaid in Florida is smart public health policy. It's also smart economic policy. And thank you so much for letting me join the conversation.
Allison, thanks. Thanks very much. We appreciate the important analysis of the economic benefits of Medicaid expansion. And finally, we'll hear from Scott Darius. Scott's the Executive Director of Florida Voices for Health. He works with Floridians across the state to lift up their healthcare struggles and the needs for Medicaid expansion and health coverage for all Floridians. Scott, just before I turn it over to you, we were scheduled to have a constituent join, but unfortunately she wasn't feeling well this morning. I wanted to share just a small bit of her story. She wrote to me because she's concerned about her son's ability to get health coverage. He has developmental disabilities. He doesn't qualify for Medicaid waiver services. And she was very concerned about his ability to earn enough to qualify for subsidies on healthcare.gov. I understand there are an estimated 54,000 Floridians who are in similar situation who have a disability but don't qualify for existing programs. So as you offer your comments, if you could also tell us what Floridians you hear from are going through on this issue specifically in this situation and more generally as well. Scott, I'll turn it over to you.
Absolutely. Thank you for having me. Like Congressman Deutch mentioned, my name is Scott Darius, and I'm the Executive Director at Florida Voices for Health. We're a statewide nonprofit health advocacy organization, and we're also a member of Healthcare for Florida, which is a coalition of community-based organizations, healthcare providers, businesses, and impacted individuals who are all working in support of Medicaid expansion. As an organization and as a coalition, we've really focused on capturing and sharing the healthcare stories of the Floridians we've come across. I think, unfortunately, what we've learned in those conversations is that so many of the people who live in this state are facing the same barriers to healthcare. In Broward, actually, we met Paul W., he's a 50-year-old diabetic who actually lost his mother and his uninsured brother due to diabetes. All three of them have diabetes, or had. Paul and his mother, who sometimes had health coverage, they inevitably had to share between the three of them, share supplies between all three of them, causing them all to run low. And even though his brother was the one in the coverage gap, Paul, who's the last remaining of the three, he's the one who has to live with the daily feeling of wishing he could have done more. In Broward, we also met Allison, who was previously uninsured and was really unable to afford the medications she needed to treat her bipolar disorder. It was without the access to medications that she experienced homelessness. And, relying on a patchwork system of care. And there really are a lot of counties and cities doing the best that they can to put together a safety net. She was able to rely on some of those, and inevitably, after a year and more, landed on her feet and now has a job that offers health insurance. But like she says, it's the medication and the access to care that kept her stable enough to maintain employment. I bring up both of these stories. I highlight them not just because they're in Broward and kind of the area we're talking about, but also because I think what stands out to me is that so many Floridians are being put in the impossible position of finding creative solutions for healthcare, whether it's having to crowdsource money and supplies or rationing food and medicine. We're asking people to do a lot. And even where local governments are doing their best to establish those safety nets, we know that inevitably there are people who fall through the cracks. It's the hardworking Floridians. And, so often the line is that these folks aren't working, but we know that most of the people who would be eligible for Medicaid expansion are in a household where there is someone working full or part-time. But most of these folks, they're working in industries that are the backbone of Florida's economy. So food service, hospitality, retail, and construction. But they're all having to inherit the risk of working in these things, in these industries, without the security of coverage. And we know that was true long before COVID. But I guess what we also know is that despite a public health emergency, the huge financial incentives, strong public support, and the individual stories like Allison and Paul's, our state officials won't even have the discussion about expansion. So when our leaders in Congress began having this conversation a few weeks ago, it was really the first sign of hope that people here in the state, low-income workers in the state, have had for healthcare really since the ACA itself passed. So now we really just hope the momentum continues and that a fix for the coverage gap is included in the final reconciliation bill. I don't think it's any exaggeration to say that the lives of our family and friends really depend on it. I'll end with saying that if you want to read more stories that we've collected, they're available on healthcareforfl.org. And also we can connect you all to any consumers, I think who are still interested in kind of sharing their story, but we're unavailable to make it onto this call today. But thank you for the time, the opportunity to participate.
Great, Scott, thank you so much. And before we open up for questions, I just wanted to quickly follow up on Scott's point and something that we've heard throughout all of the presentations, which is that it's the state of Florida that has consistently said no. It said no to accepting the tax dollars that we spend to come back to help people of Florida, help our economy, and help our families. We've already authorized funding for expansion. Florida passed on that. We can get people coverage and overcome the baseless political opposition to all of this potentially through reconciliation. The memo from Senator Schumer talks about creating a program that looks like the Medicaid Saves Lives Act that I talked about earlier, and I'm happy to answer more questions on. But with that, let me go ahead and turn it over for questions. Tiffany, do you want to guide this process? And if we don't have questions, then I have just a couple of questions for our panelists. But Tiffany, let me turn it over to you. And just by the way, members of the press can put questions in chat, or you can just raise your hand on Zoom.
Yes, just to repeat what the congressman said, if you have any questions, please put it in the chat or raise your hand and we will be able to take any questions.
Tiffany, let me just jump in and ask specifically about COVID-19. The fact is we've been struggling now for a year and a half with the many challenges about COVID-19. I think Dr. Jaquist talked about this specifically and powerfully, but can I turn over to our panelists and ask about Medicaid expansion and whether Medicaid expansion could help save lives that are currently being lost to COVID-19?
If I could, Congressman.
Yeah,
thank you. It's very interesting to see our governor's stance on this resurgence of COVID and the Delta variant. He will talk about vaccines once in a while, but it's not the big push that I would like to see. If he went around the state with a mobile vaccine unit to all the places he likes to go stump, I think that he would get people to get the vaccine. But what he's decided to do is go around and talk about treatment, which is wonderful. I hope I'm pronouncing it right, the monoclonal antibodies. That's wonderful that we have that, and I hope it saves a lot of lives. But we need to talk about prevention. So the treatment that he's talking about is a good example. If someone had insurance and they could go to a doctor and potentially be given that life-saving treatment, which is quite expensive, then they could go there and get it earlier and not end up in the hospital and needing a double lung transplant, because who's going to pay for that if they don't have the coverage? So there's a lot that we could be doing with COVID. Sometimes the disease doesn't have to end up in the hospital, the ICU, if you can get treatment from your local doctor, but you're not going to go, as the doctor said, you're not going to go for early intervention. if you don't have insurance. You're going to wait until it's so bad, and then you're going to end up in the ER and you're going to clog the hospitals. So when our governor talks about treatment, he needs to look at it in a more holistic way and say, well, how are people going to get this treatment? They have to have access to doctors, and for that, they need insurance.
Great, thanks. Yeah, please, Dr. Jaquist.
If I could weigh in, yes, I think a lot of good things from Senator Polsky, but a lot of the, not solely, but a lot of the people who have the worst outcomes, of course, in this particular pandemic and in this particular virus, are people who have many of the things we've talked about already, those comorbidities that are not well controlled, that can't be treated as well because there's not access to good healthcare in the communities. That doesn't necessarily help this particular episode, but will work for everyone in the future. And every year when we have flu, frankly, or any of the other potential viruses or diseases that can be in that same category, where the people who are at higher risks are those who have not been able to get good preventative care along their healthcare system, and therefore end up in worse situation in these times where we have this really awful disease process. And again, I think too, what we've learned about from COVID, I don't know which number we're on, but whichever COVID we were in last year to this year, I mean, people talk about it 4, is we sort of know and can categorize those people that definitely need to be hospitalized, that might be able to be cared for at home, or that don't really need to come to the department as well. And so all of those require a system that not only has a great acute care system in our emergency departments, but also has that access to care in the communities to help in those decisions, either directly when they go before they come to see us, or even after, where we can refer them back into those healthcare systems for their ongoing care. So it would certainly help a lot to have that level of access.
Great. Anyone else on this before we move on?
Can I jump in on that?
Please,
as well?
Allison, of course.
Thank you. I think that's such an important point to highlight. And I love a good data point. And there's some recent research to this question. Infectious disease researchers looked at county levels of COVID and examined COVID incidents in the context of insurance. And they found that each 10th increase in the proportion of a county's residents who lacked health insurance was associated with a 70% increase in COVID cases and a 48% increase in COVID deaths. So there's a direct correlation between uninsurance rates and COVID infection and COVID deaths. So we're seeing very clearly that if we were to expand Medicaid and give insurance to probably an additional additional 1.1 million Floridians, we would be effectively bringing down our COVID numbers.
Great, thank you. Tiffany, I think Antonio Finns from the Palm Beach Post has a question. You want to unmute him?
Yes.
Antonio? All right, and I guess Tiffany, you can allow it, and then Antonio may.
Can you hear me now?
Yes, we can. You may have
Okay, I'm sorry. I thought I'd been unmuted. Okay, so I just want to budget reconciliation. Just want to make sure I got this right. So the plan is to bypass Florida's resistance by incorporating those 2 bills that you mentioned before through budget reconciliation. And does that mean that you don't really need legislation in the state capitol, or would you still? Maybe you can sort of clarify, just make sure that I understand this correctly.
Sure. Taking a step back, Antonio, the issue here is that Florida has had ample opportunity to accept billions of dollars in federal funding, and consistently our governor and legislature have refused that. They've given up on those Florida tax dollars that are paying to expand Medicaid and offer coverage in other states. And we're I'm tired of subsidizing other states and refusing to take care of our own citizens, which is the approach that Governor DeSantis and Republican legislative leaders in Tallahassee continue to take. So what we're talking about in reconciliation is essentially going around the governor and the Republican leaders and short-circuiting their resistance by creating a program that will be administered by CMS. We don't have, there's not legislative text yet, but money has already been budgeted. It wasn't accepted by the state. Federal government can use that money. So if we can go around this opposition that has prevented 1 million Floridians from being able to access healthcare, that has led to illness and death because Floridians can't access healthcare, then we ought to do it. One study estimates that we've given up, we've passed on $66 billion. It's time that we do everything we can to provide coverage and not allow the Republican leaders who unfortunately continue to put politics ahead of the well-being of the people of Florida. Let's find a way to say yes and to provide coverage that's desperately needed by Floridians. I don't know if anyone else has comments on this.
I'll just add that my understanding of it is that there isn't because there isn't specific text yet. Like there's still a couple of different ways this thing might look. So to the question of what does it mean for our in-state efforts to expand Medicaid, the best I understand it, the frameworks that folks in Congress are working with would still leave the opportunity for Medicaid expansion here in the state. So, in case it's not a permanent solution or whatever, the state could return to it. And frankly, it's a lot of money that we're leaving on the table. Like Allison mentioned, we could save $200 million a year. The state could if we expanded. A lot of those savings are experienced by cutting down on a bunch of patchwork programs, like I mentioned. Currently, we spend a lot of money in emergency rooms. There are, programs and health offerings that we have for people in prison and things like that, mental health programs that we have running. So there are a lot of those kind of inefficiencies in the system that, I think there's a benefit to addressing at some point down the road, one way or another. So if, kind of depending on what the final solution from Congress looks like. And I also don't think it's a sure thing that it happens that way, which is why we're doing things like this to get to build public support for it. But on the off chance that it doesn't pass or it's not a permanent solution, we would still have to continue to drive the work here on the state level and hopefully push the folks in Tallahassee.
If I can ask a follow-up question, I think Senator Polsky mentioned that that going forward, 90% of the recurring costs would be covered by the federal government. I just want to make sure that's correct. And if so, is that a change because of the rescue plan? Because that's been historically the argument from the governors here in Florida and the state lawmakers is the recurring costs.
I'm going to leave it to some other people for the exact numbers. From my understanding, the first few years are covered by the federal government, and then the American Rescue Plan does pick up after that to guarantee a certain number of years at 90%. So there's, but I'm going to let the other experts give us that exact numbers.
No, Senator Polsky, you had it right. I'm sorry, Allison, you want to?
You can go ahead, Scott.
Okay, so just that it's right. At no point will the federal government's obligation go less than 90% of the total cost. So, had we passed this when we first had the opportunity, it would have started at 100 and it would have tapered off to 90. But now that we're kind of past that initial window, the federal government will pick up 90% of the cost for any kind of expansion. What we've seen is, I think part of the argument we always hear from Tallahassee is that you're right, like our cost is still too much. But what we've seen, and maybe the only good thing to come from us being one of the last 12 states to expand, is that we've watched the experiment play out in 38 other states, and all of them have experienced savings. So when you factor in what Florida's 10% obligation would be, we still come out $200 million a year ahead, which, I think kind of flies in the face of how much it'll cost us.
Allison, did you have something?
I could just add, so as to expand on what Scott said. So the 90% was it was established by the Affordable Care Act, and then the American Rescue Plan offered, as both the congressman and the state senator have shared, offered additional funds, sort of we've been calling it, the cherry on top, additional funds for states who have not previously expanded to expand. And the 90-10 split, this is getting a little weedy, but the 90-10 split is specific to the cost of coverage of the expansion population. And what the American Rescue Plan offered is an additional, I believe, and I'm sorry, it's been a couple months since I've looked at this, but I believe the American Rescue Plan offered an additional 10% for, I believe, 2 years, but that's for the entire state Medicaid population. So it would really be a huge boon under the terms of the American Rescue Plan, should we accept that. And I see, Antonio, your question. The answer is 38 states have expanded, yes, and plus DC. So Florida is one of the 12 remaining states to not expand. And as Scott said, we've seen over and over again, from states being led by each party, that once they've embraced Medicaid expansion, no, there's not a single state that has expanded Medicaid and then reversed course, which just goes to show it's working, and it's not costing the states extra money.
And
I
okay.
just want to add to what Allison and Scott said, that as Scott points out, there's about $200 million that the state will be ahead by expanding Medicare. Plus, under the American Rescue Plan, as Allison points out, it's $3.5 billion over 2 years, $1.75 billion per year, which added together, it's close to $2 billion in additional savings from expanding Medicaid for FY 2022-23. It's $1.75 billion from the American Rescue Plan, the $200 million that Scott talked about. This shouldn't be a difficult decision at all. The numbers are right, and we're going to provide much needed assistance for 1 million of our neighbors, which will help them, their families, our community, and our economy. Sorry, Senator Polsky.
I was just going to add that the statistic that Allison posted in the chat and she talked about is truly devastating when it comes to COVID and lack of health insurance. I didn't know that, and I don't think many people are aware of that. You just think it's this random disease. So that's something really important to talk about, and I'm certainly going to bring that up next session, if ever given the opportunity to talk about it. The problem is these bills are not heard, and so there's no hearings, and there's, aside from talking to reporters and holding forums, there's really no opportunity for that. But I'll point out that Texas and Florida, huge states, account for 40% of all the COVID cases in the country. And I think, now that we know the health insurance linkage, that I think is an important point to note.
Thanks, Senator Polsky. We are scheduled to wrap up in a few minutes. If press has any other questions, if you want, you can reach out to our team and we will funnel them out accordingly. I want to thank our panelists very much. Dr. Jaquist, did you have anything else you wanted to add before we close?
Just one other piece that's sort of tangential but important, and particularly right now. The issue of coming to emergency departments always gets a lot of play. What we did see last year, though, is people who truly needed our care failing to come to our emergency department. So I want to make sure everybody does understand, if you are, despite all the things we talk about in terms of preventative care and access, if you need, especially during this point in time when people are afraid about COVID and coming out, if you need care, just please come. We saw good data from the CDC, as well as our own observational knowledge, that there were changes in the mortality for people with heart disease and strokes and things like that related to not seeking care during the beginning of the pandemic. So that's the only thing I would add, Congressman.
Thanks, Dr. Jaquist. And I would just add that Dr. Jaquist is a really accomplished doctor, as are the ER docs all throughout our state. They should not, however, be the primary care physician for the people who live in our state. And for too many people, because we have failed to expand Medicaid, Dr. Jaquist is the person who sees people first. And this is one more reason that we need to take action. The efforts in Washington through reconciliation is one way to do it. Scott, I did not mean to suggest that the state should stop moving forward. I know Tina and you and Allison are going to continue in your respective ways to lead that battle. And I'm really grateful, everyone, for your joining us today. And it's a really important conversation that we will continue until we finally achieve what we can here, which is to help protect the health and well-being of the people of Florida. So thanks very much, everyone, for joining. Really appreciate it. And thanks